Dr. Levy will speak to us about complementary and alternative medicine, as well as his topic of fake medicine and what we should watch out for when considering alternative treatments. Dr. Levy received a bachelor's degree in psychology from Texas A&M University. He completed medical school and psychiatry, I can not say that word right, psychiatry resident, did I get it right? Thank you. At the University of Texas Medical Branch in Galveston, and fellowships in geriatric psychiatry and neurobehavior at UCLA. He received grant funding from the Veterans Administration to study Alzheimer's disease and is published in numerous medical journals. Morgan was diagnosed with multiple sclerosis in 1993 and was forced to go on full disability in 2004, so he no longer treats patients or does medical research. Today, he maintains a website entitled Placebo Medicine and speaks primarily to lay audiences like us on the intersection of alternative and mainstream medicine through the new neuroscience of placebo effect. Following Dr. Levy, we will be privileged to hear again from Michael Rooney, who will be talking about relationship strategies while living with MS. Mike Rooney is a licensed professional counselor and behavior therapist that has been in private practice in Colorado for over 15 years. Mike is an expert at providing comprehensive outpatient therapy for people with traumatic brain injury and other chronic disabilities such as MS. He is frequently asked to speak on topics related to behavior strategies and relationship building regarding individuals with TBI and other disabilities. He currently facilitates the Denver Men and MS support groups. Mr. Rooney was introduced to MS in 2003 when his wife was diagnosed with the disease. But now it's time to hear from Dr. Levy.
Thank you, sir, and I appreciate your talk. As I was listening to it, actually when you first started fumbling around at the beginning of the talk and you were like talking about how good of a sportscaster you were, and I thought, oh God, this is going to be boring as hell. And then you said, and I have MS. And you started telling your story, and it was like my story. And I was like, tear in my eye, and I was, so I was captivated for the rest of the talk. And I'm telling you, my story is your story on steroids. It was almost, all the same stuff that happened to you happened to me. Although I was a big UCLA brain science researcher at the best place to do that on the planet, and promising career, getting tons of money, doing talks, doing research, and woke up one morning and was numb from the waist down, and then the rest of it is basically the same thing you said. In any case, let me just tell you what my what my agenda is, the thing that I'm wanting to do, and that is that I actually have good disability insurance, and so I'm not doing talks for lots of money. I'm doing talks to lay audiences, mostly like support groups and people with MS, and not charging a dime. And so anybody that has an MS support group that wants me to come give a talk, I'm available and willing to come for free and anytime. And since I'm forcibly retired, I have plenty of free time, so I can come and do it. Basically, over the last few years, the thing that I've most focused on is unconventional medicine and its relationship to mainstream medicine. So the talk today, what I hope to accomplish in the next hour and 15 minutes is, and I noticed actually when the question and answer session came up, several people wanted to get into talking about drugs and whatnot. So I think that this is an audience that's very interested in knowing all the best ways to treat multiple sclerosis. But if you go online, or if you hear people talk, or you read news articles, you can get you can get mixed up, and it's like, what do you know? How do you know what to believe? There's great alternative treatments that are very good for MS. I do some of them myself. I take vitamin D every day. I do relaxation therapies. I try to eat right. Fish and try to But the thing is that it's a huge amount of information. It is really what I've been studying my whole life. So if you want to talk to somebody who understands very well all the things in unconventional and conventional medicine for multiple sclerosis, I'm the guy to talk to, and I'll be around here all day today, and come up to me and ask me any questions you want, and I'll tell you whatever I can tell you. But this specific talk, what we're getting ready to do right now is, I'm going to show two videos. The first video is Dr. Bolin, and he's talking about alternative medicine, diet, supplement pills, and non-biological forms of alternative medicine, some of which you may be too expensive or too risky, a lot of which are not very much risk and potential benefit, and some that are absolutely things you need to be doing. Then we're going to have question and answers. Then I'll show you a second video. And the second video is a different kind of unconventional medicine, the kind that's actually medical fraud. People trying to rip you off, and sell you stuff that you really don't want to be doing. So, and that's the video I put together. It'll also last about 15 minutes, and after that, I'll field more questions. So, so let's get going. And I also have a website at placebomedicine.com, and you can go there. It's a huge website, tons of stuff on it. I use the word placebo, and that when people hear the word placebo, they get all kinds of crazy ideas in their mind. I'm not using the word placebo to mean fake. To me, placebo, because I understand the neuroscience of how placebo can help people, placebo is actually helpful. It can treat pain, nausea, anxiety, depression, and things like that. I also use the word because you have to figure out what is and isn't placebo. Vitamin D isn't placebo. But it's just there's so much out there. How do you figure out what is and isn't placebo? That's the reason I use the word, not because I think all alternative medicine is placebo. So with that said, let's get going.
Hi, I'm Tracy Kimball.
And I'm Tom Kimball. Welcome to MS Learn Online. Complementary and alternative medicine includes a variety of interventions, from dietary supplements to relaxation techniques, exercise, and acupuncture.
In this first program of a two-part series, we'll hear from Dr. Alan Bowling, a neurologist who has been studying conventional and unconventional medicine for years. He spoke with correspondent Rick Summers about the many different options that are available for people with MS.
So complementary means that the unconventional medicine is used alongside conventional medicine, and that's actually what most Americans do. And a very small percent, maybe 5 to 8% of Americans use unconventional medicine instead of conventional medicine, and that's alternative use.
Okay, so we're talking about complementary and alternative medicine alternatives. And for the sake of the discussion, we wanted to group this into 4 categories and kind of pick through them one at a time. 1 being diet, 2 being vitamins, minerals, and herbs, 3 physical medicine, and the 4th, which is generically called other, which we'll talk about. First, let's talk about diet and the importance of really what we're putting into our bodies.
Yeah, I think the whole area of diet, if you look in the MS literature on the internet or lay books or professional books, it's really confusing. There are all kinds of contradictory viewpoints out there. And I think often it gets polarized. People want it to be all good with diet or totally negative with diet. The evidence, as I see it, is somewhere in between the two of those. So the basic concept with the most commonly considered dietary approach is that it may be helpful for people with MS to decrease their overall intake of saturated fats, things that are common in dairy products. Lard has saturated fats. So to cut back the amount of those and then increase the amount of polyunsaturated fats, which include omega-3 and omega-6 fatty acids. The omega-3 fatty acids are probably the ones that are lowest in most Americans' diet, and that omega-3 fatty acids typically are in the form of fish oils. So to kind of accentuate that intake, which can be through increased fish intake itself, or possibly consideration of supplements, but that should be discussed with a healthcare provider.
I had a doctor, a neurologist once that said, eat whatever you want. And I was very uncomfortable with that. I think it's important that we make good food choices.
I would agree with you, and my general approach to MS, which has gotten me interested in this area and makes me interested in diet and other unconventional approaches, is if you have MS, since we don't have a cure, why not just kind of get all the good chips you can on your side, and one of those chips can be the diet chip. And it's not absolutely proven, but there's no evidence it's harmful, and there's some evidence it could be helpful. So why not get the diet chip on your side along with other chips, which could be medications and some of the other approaches we talked about.
I often say that even if it's not going to help your MS, it's going to help you in other senses.
Exactly.
Of the way. How about vitamins and supplements and herbs?
Yeah, and that's kind of a blend. Goes into the diet area as well. As I was mentioning, if you're going to increase your polyunsaturated fatty acid intake, if you're going to increase omega-3 fatty acid intake, that can then lead to considering maybe whether taking something like a fish oil product. So certainly fish oil, that's something that people with MS might want to consider. Another very hot topic is vitamin D, and there have been two assumptions about vitamin D for years that we found out are not true. So one assumption is that most Americans have enough vitamin D because we fortify our foods. That's very clearly not true. Multiple studies show that many American adults, 50% or more, have low vitamin D levels.
Name a food for me that would include vitamin D.
That's a challenge, and that may be part of the issue.
Okay.
So
I don't even know.
salmon, fatty fish, typically has the highest amounts of vitamin D.
Okay.
But we fortify our foods at a level that's probably too low to account for the low levels that people have at this point. So vitamin D, one assumption was that we thought most people had adequate levels, and then the other is we thought vitamin D just helped regulate bone metabolism. And it's been shown very clearly vitamin D has effects in many different tissues in the body, including helping regulate the immune system. So the concern is if people with MS have low vitamin D, then that could lead to further dysfunction of the immune system. It could possibly lead to worsening of the disease.
You start taking vitamin D, will you notice a difference in your day-to-day? I mean, do you feel any different?
This whole story is evolving, so we don't have the exact
Okay.
answer to questions like that, and this is definitely something that needs to be talked about with a healthcare provider. And this vitamin D area is quite tricky now because some people have totally adequate vitamin D levels, so they don't need any, and other people are severely deficient and they need quite a bit to correct the deficiency that they had. So those are two supplement approaches, and then so that's fish oil and vitamin D. And then on the herbal side, cranberry may be helpful for preventing urinary tract infections. Valerian might be helpful for insomnia. St. John's wort for mild to moderate depression. So those are some other, those are things on the herbal side that may be helpful for some MS related.
But again, and I think we really want to emphasize that you shouldn't just take it upon yourself to jump into the pool.
Exactly, and I think especially with these dietary supplements, because they're chemicals just like drugs are chemicals, and they can produce good therapeutic effects in the body, but they can potentially have toxic effects. They can also potentially interact with other medications. So the complex question, even though it's a supplement that you can just go to the grocery store and buy it off the shelf, it still is altering the chemistry of your body.
Let's talk about medicine and physical things that you can do. And Tai Chi I'm not overly familiar with, but these are all areas that basically you dabble in.
Right. So in terms of physical methods or body-based methods that are on the unconventional side, two that have been studied somewhat in MS are yoga and Tai Chi. I think most people are familiar with those. They involve stretching the muscles in pretty extreme positions. They involve a lot of balance, include strengthening of the muscles. So that happens with yoga as well as Tai Chi. In terms of formal studies, actually a very high quality study that looked at yoga in people with MS and found that yoga as well as conventional exercise was helpful for preventing MS-related fatigue. with Tai Chi, a couple of lower quality studies, but they indicated some improvement with muscle stiffness or spasticity, and also with walking steadiness. I think it's interesting when you think about yoga and Tai Chi. I think certainly if you have ever tried one of those, or if you just can imagine in your head pictures of people doing those, it's quite interesting that they involve controlling the muscles, producing muscle movement. So it's kind of signals going from the brain out to the muscle group, and that's kind of what we typically think of it as exercise. That's what we often do with Western-based exercise. But those extreme postures with Tai Chi and yoga also involve sensation signals that come from often the feet and then go all the way up to the brain. So there are signals kind of going down to the muscle and also signals kind of coming back up. And that's something that's different with those sort of unconventional exercise methods relative to some Western-based exercise. And it may be a way to sort of condition or exercise the sensation part of the nervous system that we often don't get with Western-based exercise.
Yoga, Tai Chi, are there others?
Those are the two that are most common, that have been most studied. Pilates is certainly something that's popular, very good at strengthening the core muscles, and that may be very helpful for people with MS. Often the core muscles get weakened, but there haven't been any formal studies of that. A very infrequently thought of therapy, but certainly is something happens quite often in Colorado, is hippotherapy or therapeutic horseback riding. So there actually have been studies in children with cerebral palsy, and then limited studies in people with MS. Not perfect studies by any means, but studies suggesting it could help with walking stability, might help with muscle stiffness, could help with bowel and bladder function.
Talk to me about acupuncture.
Yeah, acupuncture is a component of what's called traditional Chinese medicine. So there's acupuncture, Chinese herbs, relaxation methods, including meditation. It's actually quite a holistic approach, and maybe has a better holistic approach, does have a better holistic approach than conventional Western medicine, I think. For the acupuncture piece, has not been well studied in MS, but in other conditions looks like it might be helpful for pain. Could also potentially be helpful for some other MS symptoms like anxiety or depression, but has not been well studied there. I generally think of acupuncture as something that's quite low risk and may be helpful for one or more MS symptoms, but I think it's very important for people with MS to keep in mind that often at an acupuncture treatment session, at the end of the session, they'd be given a bag of herbs to take after the acupuncture. And I think of those herbs, they're kind of the opposite in my mind as the acupuncture itself. So the herbs, those are chemicals. They can potentially affect the immune system, might antagonize the effect of MS medications. Those herbs have never been shown to have a beneficial effect on the disease process of MS or the symptoms of MS. So acupuncture is low risk, possibly helpful. The herbs, no known evidence for benefit, and some significant theoretical risks with those.
Obviously, if you're going to choose an acupuncturist, that you should choose somebody who's familiar with MS.
Right, if you can, and there are national listings of trained, certified acupuncturists.
We had mentioned at the top talking about other, and
Right.
It's a category all to its own, and talking about aromatherapy, different relaxation techniques. I have friends that have said to me, yeah, you should put magnets in your shoes. Everybody seems to come out of the woodwork when they have, their own method of how we're going to solve the MS problem. Tell me about some of those.
Yeah, I think that other category is, it's full of lots of different therapies that often are not thought about. And just to kind of put it into context, in the unconventional medicine world, there are sort of biologically based approaches like diet and dietary supplements. And then there are the non-biologically based approaches, which include some of the physical methods we talked about, but then also other methods like relaxation methods. And I think often when people think about using something unconventional, they just think of biological methods like diet and dietary supplements. And biological approaches, they're done quite well by Western medicine. And I think a lot of the richness and uniqueness of unconventional medicine is often in those non-biological approaches. So of those non-biological approaches, I think one that really is kind of neglected by conventional medicine, neglected in the American culture, is just relaxation methods. The body has different responses built into it, biological responses. So there's a fight or flight response. If you're getting chased by an animal, you're going to get supercharged and may have extra strength. The reverse is called a rest and digest response or relaxation response. And that's something that American culture definitely does not cultivate. We're kind of type A, hyperactive, just kind of moving all the time. It's good to be moving and producing and accomplishing. But much of the world actually uses the relaxation response, meditates on a daily basis, or appreciates what it can do in the human body, and the body's programmed to do it. So there are various ways that that can be done. People often think of formal meditation, or they start thinking about spirituality, and then they think about going to Tibet for 10 years and they have to study under a monk, have to get very involved and make it a spiritual thing. I think it's important to keep in mind that the core of it is biological, and it's actually quite a simple biological response. You can add spirituality onto it if you want to, but the core relaxation response, that's quite easy to produce, doesn't require extensive meditation training. So there's very simple meditation techniques, just involves simple breathing, closing the eyes, repeating a word when you exhale. And then there are somewhat more involved methods with guided imagery, but same thing, those are very simple. You can listen to a guided imagery tape once and you can feel the relaxation response.
One of the things that comes to mind as you're talking to me right now about this is the word control. And as an MS patient, of course, you feel like you have none. And by embarking on some of these complementary alternatives, it's a way for you to assume a little bit of control and steer the rudder a bit for your course of trying to find a way to cope and maybe feel better.
What an observation. Yeah, I think you're right on, and I think that's a lot of the power of what I was saying, these non-biological, unconventional approaches. A lot of what they do is just tap into the healing that we already have within our body. And I think as Americans, if we feel something going on, something doesn't feel right with our body, right away we think have to take a drug, have to have surgery. We kind of look outside our body. And that can be very sort of take away your sense of control. If you know you have a relaxation process within you and you can turn it on whenever you want, that gives you a real sense of empowerment, sort of mastery, and your body, even if your brain, even if it has lesions in it, it still can produce this relaxation response.
Well, I think in part it's about owning this disease that you're dealing with, and it's not enough to say, I have this disease, I've gone to a doctor, I'm on a drug, I'm the patient, you're the doctor, fix it.
Right.
There really are quite a few options that people can consider using along with their conventional treatments.
That's right. In fact, there are so many options, we couldn't fit them into one program. So join us for part 2 when Dr. Bowling and Rick Summers continue their discussion.
But remember to talk to your physician about complementary or alternative approaches you might be considering. You want to be sure that these options are helpful and not harmful.
See you next time.
Is the material that you just saw stuff that you were generally familiar with, or did you learn anything, or yeah?
Yeah, hey, I know people that do the paleo diet, and one guy couldn't walk. He was in a wheelchair, and after 2 months of doing it, he was able to get up and walk. So was that just a placebo effect for him, or has anybody got any input on that? Or?
Yeah, that's an absolutely excellent question and speaks exactly to the heart of what my main message is.
Right.
Because the paleo diet is a perfectly reasonable diet. It's a healthy diet. I mean, there's
kind of hard to do.
Yeah, the basic paleo diet. I mean, there's like a lot of extreme forms of the paleo, there's multiple forms of the paleo diet. I wouldn't necessarily go there, but just in general, you know, it is eating healthy, you know, lowering the amount of saturated fatty acids and eating, you know, nuts and fruits and vegetables and fish and trying to cut back on bread and pasta and red meat and milk products. And generally, that's a healthy diet, and you should be doing that whether you have MS or not, right? So us that have MS, that it's more important for us to be as healthy as we possibly can if we're fighting something like MS. So there's nothing wrong with the paleo diet. But the placebo sneaks into everything. And the placebo isn't bad. The placebo can be really good. You just have to understand what its limitations are and what it can and can't do, right? So for example, maybe this guy that was taking the placebo diet got this really positive attitude about how much this was going to help him, and maybe his pain got better, maybe his nausea improved, maybe his anxiety or his depression improved because of psychological reasons, not because of direct pharmacological reasons, and that's what we call the placebo effect. And maybe he took that further, and you know, maybe he would just had the resolution of an episode of MS, and he attributed it to the paleo diet, and that's the placebo effect. So that's sort of, I think in a nutshell, that's how this stuff works. So that was a really good question.
With the placebo effect, do you ever see real changes in like blood chemistry or anything like that that is actually a result of placebo effect?
The way I'm going to answer that question is I'm going to tell you exactly what the placebo effect can and cannot do. I think this is something that is kind of obvious to me because I've been studying it my whole life, but is really, I think, not obvious to a lot of people. The placebo effect is great for pain and nausea, and most psychiatric and psychological things like anxiety, OCD, depression, stuff like that. And also, it's fantastic for psychosomatic disease. That means, you know, disease that's all in your head. Placebo works great for that. But placebo works for things that are compensatory brain mechanisms. So for example, your body comes prepared to fight disease and illness, but not in specific ways, in sort of general ways, right? Your body doesn't come prepared with a specific antibiotic to kill a specific bacteria. Your body doesn't come prepared with a specific blood pressure medicine to treat a specific heart condition, right? But your body does come prepared with innate opioids for pain, an immune response for, you know, inflammation or infection. I mean, you have natural mechanisms that fight disease and stuff, right? And these are mechanisms I call compensatory mechanisms. So if I got shot with an arrow in my arm, the compensatory mechanisms is that my brain is going to produce opioids, and there's going to be an immune response at the site that sends lots of white blood cells to fight the infection, but it doesn't really send antibiotics, right? And placebo can affect your brain in such a way that it can produce some of these compensatory responses. But placebo can't treat a broken leg, it can't cure cancer, you know, it can't treat kidney or liver disease, you know, so placebo has its limitations, is what I'm saying. And if you look at studies, right, so let's look at studies for cancer drugs. A cancer drug that's like 60% effective, in the placebo-controlled trials, the placebo was like 2% effective, right? But let's look at a depression study. In depression studies, when you have a drug that's 60% effective, the placebo was 50% effective. You know, so the placebo is good and a good treatment, but you have to understand what it can and cannot do. Everything has its limitations. Does that kind of address the question?
I understand.
Yeah.
I
Sorry.
have two outfits.
I'm sorry?
I've run 2 groups, Longmont and Lafayette, and with the Levy, we work together to run these. And one of the things we found out, we've had people do the cherry walls, we've had people who've done the paleo, and everything seems to work for a lot of people, but only certain parts of it. And it all is good, and good information that we found out so far, but you know, it doesn't work for everybody. It works for some. So you got to try these things and see if it works for you. And you can't just say it's going to cure me.
Yeah, that's exactly correct. And that's actually the message that I want to teach everybody today is when you, if you aren't a medical physician and you didn't spend a lot of time studying brain science and then getting one of the brain diseases that you were studying and then living for a long period of time and coming in and deciding to start studying, you know, unconventional treatments. If you didn't do all that stuff I've done in the last 20 years, and you go online or you go to a talk and you hear all of these treatments, I mean, you can go online and you can see people saying, I have the cure for MS, and it's this or that or the other thing. And they all sound very exciting and they're very compelling. You know, a couple months ago we had a speaker come to my support group, and he was extremely compelling. And when he left, everybody wanted to buy his product. And I was like, no, wait a minute, guy. The guy was he was completely full of BS, okay? Let me explain it to you. So it's hard, I think, for just Joe, general public person to really assess, you know, is this a legitimate treatment? Is it cost effective? Is it risky? Does it offer potential for helping me? Or is it just something that is completely not going to help and somebody's trying to rip me off? Or is it somewhere in between? And is it something that is probably worth trying, and even if I get some placebo effect from it, it might be positive, good placebo effect that would actually help. So it's really complicated and it's really hard to figure all that stuff out. So, okay. So what I want to do is, in this, as a result of this talk right here, is I want you guys to leave with better tools in your tool belt to make the assessment on your own in the future when confronted with, you know, any form of unconventional treatment. Does that make sense? And just to explain a little bit more, oh no, actually I'm running out of time, so I'm gonna do the next video. Now this video was made by me, and this video, unlike the first video, is pretty much more focused on medical fraud. You know, things that either somebody just wants to make money and is trying to rip you off, or somebody is just heavily biased and creating a treatment that absolutely doesn't work, but they really think it does work. And how to assess if that's the kind of thing that you're seeing and, you know, needs to be clearly avoided. So this is more about actually fake treatments, as the title would suggest. And after we see this, then I can answer some more questions.
Look away, Dixieland. That sure is a sweet sound to the ears. Wouldn't you say so, Mr. Wales?
Your young friend can use some help. This is it. $1 a bottle. It works wonders on wounds.
Works wonders on just about everything, huh?
It can do most anything.
Comes it with stings.
The selling of snake oil is big business, and it is really easy to fall prey to charlatans who want to take advantage of a vulnerable patient population in order to make a profit. I would like to teach you a few things so that you could better protect yourself from this type of fraud. First, make sure that your source of information is legitimate. For example, I am Dr. Morgan Levy. I am a UCLA-trained physician and researcher who studied patients that had brain injury, including patients with multiple sclerosis. Then, in 1994, I was diagnosed with multiple sclerosis. So you can see I am a relatively legitimate source of information. Second, if you can't be sure about the source of information, there are some telltale signs of fake medicine that you can be on the lookout for. For example, the use of words like amazing or miraculous, a secret formula, a natural treatment that has no side effects, a single therapy that treats numerous conditions, claims that are anti-conventional medicine, failure to mention effectiveness, safety, or cost, or that they are trying to sell you something that only they are selling. The fact is that multiple sclerosis is a unique and extremely complex condition. Thousands of researchers and millions of dollars over 70 years have yet to discover the cause of multiple sclerosis. And the 9 treatments that have been proven to slow the progression of multiple sclerosis were discovered serendipitously. That is to say, we have little idea of how they actually work. So, why is multiple sclerosis so hard to study? It is hard to study because it involves a cascade of events in the immune system, which is the most complex system in the human body, more complex even than the brain and nervous system. Here is an oversimplified chart showing just a few of the immune-related components that are involved. You can easily see here how the innate complement activation system responds to a pathogen, causing natural killer cells and dendritic cells to proliferate, releasing cytokines that increase capillary permeability, and through chemotaxis stimulate interleukin factors and components of the adaptive immune system, such as the humoral antibodies produced by B lymphocytes and the cell-mediated immunity mediated by T lymphocytes. Okay, I'll stop. But just understand that it is tremendously complicated. Let me explain it a little differently. Let me just give you sort of a visual so that you can kind of try to understand what I'm talking about in regards to how complicated the immune system is. You can think of the cascade of immune-related events as a line of dominoes that must fall in the correct order before the disease manifests itself. As you watch these dominoes fall, understand that there's all kinds of feedback mechanisms and multiple different cells involved, and we really only know about 10% of how this process works in the human body. Multiple sclerosis is famous in medicine for being the disease of a million cures because it affects young people in the prime of their lives, causing them to be paralyzed, and then it remits so they can walk again. Therefore, doctors have a huge desire to treat it, and anything you treat it with seems to work. Now that we have some real treatments that really do work, you would think a lot of these fake treatments would go away. But that's not how it works. You see, in medicine, when any new treatment comes out, it generally spawns a number of fake treatments. Right now, as we speak, there are literally thousands of websites on the internet that are promoting fake treatments and fake cures for multiple sclerosis. It is profitable and usually legal and easy to do. Okay, why don't we watch a brief video that describes the history of selling snake oil.
We have all heard it. That guy's a snake oil salesman, a shyster, a con. This terminology has become an intricate part of our culture, but where did that term come from? Were there really snake oil salesmen? Did they really sell snake oil? It all began when the Transcontinental Railroad was being built in North America. Chinese immigrants came over, and with them their cures for the aching joints and muscles that they had at the end of each workday. What they used was snake oil. Americans, seeing how well this remedy worked, jumped on the bandwagon, and word quickly spread that this was a cure for rheumatism, joint pain, and other things. The craze soon developed into a fervor. People began snake farms. In the Patriot newspaper in 1885, rattlesnake oil was said to be going for $4 an ounce. By 1891, the Wheeling Register claimed rattlesnakes were going for $25 to $50 each if they were 4 feet or longer. Soon, snake oil salesmen were everywhere, touting the wondrous claims of this cure. They would grandstand at circuses and carnivals, thrilling the audience with their hissing rattlers and claims of the wonderful drug. Clark Stanley was the most famous snake oil salesman and became known as the Rattlesnake King. Problem was, there wasn't much snake in the snake oil. Mostly, it was mineral oil, camphor, turpentine, and red pepper. It did little to relieve the sore, aching muscles, and suspicion grew. Even when it was made with authentic rattlesnake oil, it never seemed to match the claims of the Chinese workers' oil. So why was that? It appears when the Americans made their snake oil, it was done with rattlesnake. This was the crux of the problem. It was the wrong snake altogether. In 1905, Collier magazine did an expose on the snake oil salesmen, declaring them frauds, pushing useless and sometimes dangerous cures. The public was furious that they had been duped, and they led to the Pure Food and Drug Act being passed in 1907. So why did the Chinese product seem so miraculous when the American-made one was a dud? Well, the Chinese used a completely different snake in their oil. The Chinese water snake, Hydra chinesis, was used, and as it was aquatic, it ate mostly fish, something rattlesnakes in the desert never do. This made them particularly useful for fighting inflammation. EPA acids or omega oils have been found not only to reduce inflammation, but reduce high blood pressure, cholesterol, and depression as well. Neurophysiology researcher Richard Cunin brought redemption to the snake oil in 1989 when he wrote a letter to the Western Journal of Medicine claiming that Chinese water snakes had almost 20% EPA oil, higher than the salmon at 18%, and rattlesnakes had a measly 4% oil. It appears that snake oil was an effective remedy after all. So when we make claims that something is to be believed or not, we may not have all the facts. What we think may be true may be false, and what is believed to be false may actually be true.
There are currently 9 medications that have been proven with double-blind placebo-controlled trials to actually work for multiple sclerosis. We call these disease-modifying agents. They are Limtrada, Tecfidera, Albagio, Gilenya, Tysabri, Rebif, Copaxone or Glatopa, Avonex, and Betaseron or Extavia. So, how does the average Joe avoid falling victim to a snake oil salesman? Well, the FDA has a website to protect people against medical fraud. Here is a 3-minute video from that website that describes really well how to avoid being taken in.
At this very minute, someone is falling for a health fraud scam. On TV, online, in print ads, in stores. It's happening all around us. But spend just a little time with me right now, and we'll show you how to see through health fraud scams. By being smart, being aware, and by being careful, you'll be able to identify and avoid health fraud scams. What exactly is health fraud? Just what it sounds like, a scam. A way to deceive people about health products that may not be all they're cracked up to be. They play on our desire for a quick cure, and then they bombard us with savvy marketing. And these companies target all of us, promising help with weight loss, sexual performance, aches, pains, memory loss, and other age-related issues. Even people with more serious medical conditions like cancer, heart disease, HIV, Alzheimer's, and many more. They use TV infomercials, the internet, magazines, and direct mail. They even recruit people, perhaps even family and friends you know, to spread the word about their products through word-of-mouth marketing. They make claim after miraculous claim, miracle cures, wonder drugs. And for those who need hope, it's tempting to believe them. But think of the consequences of falling for these health scams. Sure, it could cost you lots of money, wasted on worthless drugs, supplements, devices, test kits, and treatments. But it could also cost you your health. And by using unproven health products rather than the appropriate treatments, you might miss your window of opportunity to diagnose and treat a serious disease or condition. These products might make you even sicker. They could interfere with your medicines. They could even kill you. So what should you do? Well, the FDA wants you to know the red flags you need to be on the lookout for. Be aware of claims like quick fix, scientific breakthrough, cure-all, or no-risk money-back guarantee. And if a product claims to cure a wide range of unrelated diseases, be suspicious. And many serious diseases don't even have a cure, despite what some companies claim. They'll also use personal testimonials and doctors played by actors claiming amazing results to scam you. You'll also want to be especially careful on the internet. This is one place where you'll find more and more products tainted with potentially harmful ingredients, including prescription drugs, steroids, and other chemicals not listed on the label. The bottom line is this: if it's an unproven or little-known treatment, talk to your doctor or healthcare professional before you take anything for your health problem. You'll want to protect your personal information, including your Medicare ID number. Never give it out in exchange for a free offer. How many people do you think have been scammed just in the time that I've been talking to you? Too many. It's happening all around us, every minute of every day. So don't be a victim of health fraud scams. Be smart, be aware, and be careful. For more information on how to spot health fraud scams, visit fda.gov/healthfraud.
Sometimes it can be difficult even for a highly educated scientist to spot a snake oil salesman. As a researcher, I often saw other researchers who were simply failing to do research in the correct way. They were coming up with results that could not be replicated. In other words, results that were fake. Interestingly, it was not always the case that they were simply trying to rip people off and make money. It was often the case that they really believed their fake results because they just weren't doing critical thinking in the correct way. Maybe they had a bias. An example of this would be the Italian surgeon Paolo Zamboni, who in 2009 found that balloon angioplasty of a jugular vein could cure 100% of people with multiple sclerosis. When others tried to replicate these findings, they could not. In order to be socially appropriate, us scientists refer to what he did as not adequately controlling for bias. What we really mean is, that idiot does not know how to do research. The thing is that you have to have a bit of compassion for Paolo because his wife has multiple sclerosis, and I think he really was, trying hard to find a cure, and that he was maybe a bit overly optimistic. But he also owns patents on some expensive ultrasound technology that is used to diagnose how open a jugular vein is. And the criteria was actually just made up by him. So when you look at his research, you kind of have to wonder, I mean, can you say bias? Another popular scam these days is fake stem cells. Stem cells are very popular and offer tremendous promise in the future, but are currently experimental and not approved for treating multiple sclerosis. Stem cell treatment can be very expensive and extremely invasive. You have to wipe out your entire immune system and regrow it. And the problem is that we don't really know how to regrow it in a way that creates the exact type of immune cell that will fix the problem with multiple sclerosis. We're not even all that close. Nevertheless, here are some websites that advertise stem cell treatment for multiple sclerosis. Bottom line here is don't go to Mexico and spend $100,000 for stem cells that don't work. Science and medical research is something that humans have only been doing for a short time. We are not very good at it, and it takes a lot of training to be able to do it at all. A simple way to think of it is that in order to do good research, you have to learn how to think logically. The problem is, our brains did not evolve to do logic. Logic is not the way that humans think. Our brains evolved to be really good at making heavily biased guesses. Our brains also evolved to have a strong sense that previously held viewpoints were accurate. That is how our brains work. It is also what snake oil salesmen take advantage of. They tell you things that are consistent with your previously held ideas, and they basically tell you what you want to hear. Scientists and legitimate physicians, that is, MDs and DOs, on the other hand, they tell you things that are not consistent necessarily with your previously held ideas and things that aren't necessarily what you want to hear. So it's obvious and easy to understand how a patient who has a serious disease or illness might ignore a regular physician and believe a snake oil salesman. I hope we can now understand and appreciate a little bit better how not to be taken in by snake oil and how to obtain legitimate medical treatment. But I'm going to be here all day, so I'm here to anybody wants to just walk up to me and talk can for the whole rest of the day. Yeah.
A lot of the medicines that we're on right now, if you look at the research is 28% or 30% or 40%. I don't think anybody's even in the 80%. So with the medicine we're on, as you talk about snake oil and stuff like that, basically a lot of these medicines that we take for MS right now are questionable.
Let me clarify that. That's a really good point. But let me clarify it a little bit, because it's easy for me to understand how you could see it that way. For a long time, multiple sclerosis has had 1 million cures. In fact, in medicine, we call it the disease of 1 million cures. Because anything that you treat it with seems to work, because it's relapse remitted. So if you're crippled for a few months, you get better. So if you were treating it with juju beads, the juju beads are what got you better, right? So the only way to figure out if you have a treatment that works is to do multiple double-blind studies to try to eliminate as much bias as you can and to follow people for long enough to figure out exactly whether these medications are working or not, right? So we've done that, and we have 9 treatments that have been through years and years of multiple studies like that to really, and we feel very solidly that these medications do slow the progression of multiple sclerosis. None of them cure multiple sclerosis or make it go away or treat lesions that you already had before you started taking the medications. But every one of the approved therapies slows the progression of the disease, and we can say that with a lot of scientific evidence behind it. What was the other part of your question?
No, there's nothing that's in the 80% category of positive effect.
So here's the other thing. The other issue is, and what makes it confusing is, the placebo effect. Earlier when I was talking about the placebo effect, I was only talking about one aspect of the placebo effect, and that is the aspect that actually has real effect on your brain to cause a compensatory brain response. But most of the placebo effect is misperception. And one of the worst things for placebo effect is a disease like multiple sclerosis that is relapse remitted. And so part of a placebo effect can be that you just misunderstood. You treated it with one thing and that thing wasn't the thing that got you better. Or maybe some other medication that wasn't under study is what got you better. Maybe just time is what got you better. You know, most diseases resolve in time. You know, if everybody in here had a cold and I treated you with juju beads and a few days from now you didn't have a cold anymore, you might think juju beads cured your cold, right? So there's a lot of things that go into placebo, and with MS it's especially bad in that way. Yeah.
I think part of his question is the fact that not every MS medication, nor medication for any disease, is effective in 100% of cases.
Oh, absolutely.
So it may only be.
So here's another aspect that I was going to say actually when I first started to talk, and then with my MS forgot. The other issue is MS isn't one condition. We don't know what causes MS. We don't know how our treatments work. And it's actually probably at least 6, if not 10 or 15 different diseases that we haven't fully elucidated yet, because as I showed you that picture earlier, the immune system is really, really complicated. So it might actually be that we're using, Avonex for MS, but the MS we're using it for, if we have let's say we're treating 500 patients with MS, these 500 patients might have 6 different illnesses, right? So if we get a 40% response, we're getting a 40% response to maybe 1 or 2 of those illnesses, and maybe half the people in the study don't even have the thing we're treating, right? So that's one of the complicating factors that makes MS so hard to study, right? But what we do is, that's why we compare it to placebo. And what we can say is that these medicines that are approved are significantly better than placebo, but it's still disheartening that they don't treat 100%. Yeah. I'm sorry. Okay, that caused lots of hands to go up. We don't have much time, but basically if I don't get to you, just come up to me afterwards. Yeah.
And I don't want to get into a conspiracy theory concept, but the recent media stories about the big pharma with the EpiPens is probably the most recent that I can think of. Can you talk about that and how pharmaceutical companies, as far as MS medications, what's your take?
I have a lot of information about that, and if you want to have dinner sometime, I'm a researcher. I'm a pharmacological researcher. I've made a lot of money giving talks for drug companies. I've had intimate relationships with drug companies, and I know everything that's good and bad about drug companies pretty well, okay? There definitely are some bad things about big pharma, but in some, they do produce all of these wonderful treatments that we have available these days, but transparency isn't always an advantage when you're a private company trying to make money. So there is conflict between what's in our best interest and what's in their best interest. So sometimes those conflicts don't work out to our best interest, and there's a lot of people in Washington trying to change some of the laws to make that work out better. In fact, every year they do change some laws. In fact, when I was giving talks for drug companies, a lot of the things that they were doing, they're not doing anymore. In fact, I think even whatever the drug company is, which one is it? Yeah. I mean, it was a question whether we could even do it at Coors Field, because I made a law you can't do a meeting like this sponsored by a drug company at an athletic field. So I mean, they're coming up with all kinds of laws to try to bridge, the interests of the drug companies, but no drug companies are truly evil. I mean, they really are out there studying really hard and making, groundbreaking therapeutics that work and all that kind of thing.
So to your knowledge, no one is sitting on the cure of MS?
No one is sitting on the cure of MS.
I heard that about cancer.
Right.
Someone out there had.
I mean, in order to believe that, let me put it this way, because, obviously, who am I? You just met me this morning. Why should you believe me? If you're going to believe that somebody is out there sitting on the cure for MS, what you would have to believe is that literally several 100,000 researchers around the world who've been studying this for 70 years haven't figured it out. And this one guy over here that's a charlatan has the secret. Do you believe that? Okay.
I've got some swampland in Florida for sale.
I'm sorry, what?
I've got some swampland in Florida for sale.
There you go. So actually, I tried to report to you several times, but unsuccessfully. Go ahead.
Kind of a preliminary question back from your first presentation. I believe you kind of or basically supported some acupuncture positive results.
Absolutely.
And at the same time, you were negative on Chinese herbs, or not negative, but there's nothing positive in the Chinese herbal type of medication.
Not necessarily.
Okay. Okay. Now, so my question, my real question is, I long before my MS diagnosis, I had really positive results with acupuncture, and my wife at that time also had positive results. So I'm very supportive of acupuncture. Are you familiar, or can you share with us any specific symptoms that you're familiar with that acupuncture has actually had an effect on a symptom?
Yes. Basically, acupuncture is in its purest form 100% placebo, which is not a bad thing.
I'm going to cut in real quick. You say 100% placebo. You're saying that acupuncture does not have the physical acupuncture technique does not have an effect on energy flow or anything that...
No, absolutely not. Isn't that confusing?
That's confusing. Go ahead.
I'm saying it's a placebo, but it's a very effective treatment. Have you ever heard anyone say that? No. Okay. You remember how we were talking earlier about what placebo can do? Placebo can change brain chemicals. Placebo can cause your brain to... And when I say placebo, I can put no pharmacological agent into your body at all. I can just talk to you in a way that causes your brain to produce more opioids and causes your pain to go down. That's placebo. That's a real effect. That's a real physiologic effect, okay? So when I say acupuncture works, and also if you look at all kinds of placebos, some are more effective than others. Some are more salient than others. We know that if you take a placebo that's a red pill for pain, then it works better than a blue pill. If you take a blue pill for relaxation, it works better than if you take a red pill. You know, so there's all different kinds of placebos. You know, chiropractic care, lots of this stuff, and different placebos work better. So it turns out chiropractic care and acupuncture are two of the best placebos, most effective placebos. But it's the relationship with the acupuncturist and how they explain it to you, and the way that they deliver the treatment has a real effect on your brain to get your body to use some of its natural compensatory responses to actually treat what you're trying to treat. So here's the catch. You have to understand its limitations. So if you want to tell me, you know, should I use acupuncture to treat my cancer? No, it's not going to treat your cancer, okay? Should I use acupuncture to deal with the muscle spasms and the pain I'm having with MS? Yeah, it's great for that. In fact, it's one of the best treatments we have for that. Right?
I'm sorry to cut in again, but the acupuncturist that I have had experience with is highly regarded and highly studied, and has been using the same techniques of placing needles into a person's body very efficiently for many, many years. And you're saying that putting it in has no effect at all. It's all in your brain.
No, that's exactly the opposite of what I just said. I said it does have an effect.
But the placement of the needles has no effect?
It's been proven in really well done studies repeatedly that placement of the needles is irrelevant. You can place the needles anywhere and they have the same effect. You can even use fake needles that don't actually penetrate your skin, has the same effect. The effect really is more in the relationship you have with the clinician, the doctor-patient relationship, which I think is something huge we've lost in Western medicine. Doctors don't spend much time with you, they don't talk to you, they don't comfort you, they don't take advantage of the things that will help your brain and body use its natural healing mechanisms to help you feel better, and acupuncturists do. That's why I often refer people to acupuncturists, tell people to go to acupuncturists, but you have to understand its limitations. I mean, it can treat pain, it can treat nausea, it can treat anxiety, obsessive compulsive disorder, depression, psychosomatic illnesses, which is a lot of people, but it's not going to cure your cancer, it's not going to treat a specific bacterial infection. You know, if you have liver disease, it's not going to treat that. So you just have to understand what they work for, what they're good for. But I highly recommend the use of acupuncture, especially for people with multiple sclerosis. Okay, one more question?
One more.
Okay.
You know, when they have the trials on the drugs, they have an efficacy. And one of the things that we have when I visited the MS team at university, things we looked at is, I started with Avonex, and really at the top of the heap is rituximab with an 80%, 90% efficacy. But isn't that where you want to go, is you want to go up the ladder to have, you know, to basically have the best results for yourself, considering that the trials prove that efficacy in that particular trial was 90, 80% for rituximab or colizumab that's going to come out in February, whatever. I mean, that's some of the things I go for to say, you know, but now I'm going to look at a study with Corboy about getting off meds completely because I was late onset MS. So, you know, but efficacy, I think, of the particular trial study results, isn't that something we should to go for?
Absolutely not. And I'll tell you why. I mean, clearly I can understand why that would seem like something that would make sense to you. But if you're a researcher and you understand how research works, you absolutely can't do that. Because what you're going to do is you're going to make the exact same mistake that people have made for the last 60 years in coming up with all these fake treatments for multiple sclerosis. You wave juju beads at it, you get better, oh, the juju beads are what got you better, right? That's the mistake you don't want to make when you're evaluating one of these new treatments for MS. And you have to remember, every new treatment we're evaluating for MS wasn't because we know what causes MS and we figured out how to fix the problem. These are treatments because we tested 1 million treatments and we just happened to find a few that work. So these are serendipitous, you know, came on accidentally, and so now we're trying to test them and see if they work, right? And anytime you test a medication, there's a zillion variables involved, right? So if you do one study over here with this particular medication on this particular patient population, and it's a long-term study, and you control for all these things and whatnot, and you come up with results that are like 90%, you know, this medicine is 90% effective, right? And then this other study, there's this other medicine that was 45% effective, right? And it's really tempting to say, I'd rather take the drug that was 90% effective, right? But these are two completely different studies with completely different sets of variables where completely different things were done. You cannot make that comparison. You can't say this drug is better than this drug based on those two studies. The only way to do that is to take both drugs, put them in the same study, do them head-to-head with placebo-controlled, and that's why it takes such a long period of time and it's such hard work to come up with. I don't know if your question was a little bit long, and I have multiple sclerosis, so I might have missed it a little bit. But did that answer the question?
Well, yeah. Well, you know, like one of the neurologists at the MS Center at University where I go, I mean, they were saying, look, this one is the latest, you know, and this one had, you know, you should be on, try to get to rituximab, so that it has the highest efficacy rate. Now, you know, I believe what they're recommending. On the other hand, I see what you're saying. But here I am, you know, as the basic person, you know, then I worry about lymphocytes with Tecfidera, my lymphocyte count that's been going down, and then the risk of PML sneaking in there. I mean, there's a lot of things.
Let me say it this way. As of right now, there aren't very many studies that compare any of the disease-modifying agents against each other. I think there's a couple that might, I think there's like an Avonex versus beta-seron study or something, but there's not very many. These are big, expensive clinical trials and big drug companies, and you know, once they get the drug approved, they don't have a whole lot of interest in continuing to do studies, right? So there's not a whole lot of studies comparing the drugs. it appears to me, knowing most of the literature on all of these drugs, it appears to me that other than Avonex, which I think is probably the least effective, most of these drugs are about as effective. You cannot say one is more effective than the other. So when you're making the choice between these drugs, I would make the choice based on side effects, based on the type of MS you have, based on the experience of the practitioner that you're dealing with. And I wouldn't look at one study and to see, and see, oh, that's 75%, that's better than 35%. I would consider most of the disease-modifying agents are about equally effective and is the best you can really say right now.
But that was a recommendation from a neurologist who's at the MS Center there at the university.
Right, but that may have been for your specific situation.
Yeah.
You can't maybe generalize it for everyone in this room. Yeah. Is that it? Okay. So, we got one more. Just right, I guess.
With the 90% of people that you say have used this medicine, and the 45%, and when you got to the point where it was, you found out it was 9% and 45%, have you ever changed that medicine from the 90, took it over to the 45% and the 45% to the 90% and come up with anything?
I'm not 100% sure I understand the question, but I think I do. What I want to do is basically sort of restate what I said before, and that is, if you're looking at two completely different studies, you can't say anything comparing the two drugs. Because there's so many variables involved that could be affecting the outcome, and there's so many things that you have to control for. Let's say, for example, that in this study over here, of the 6 different kinds of multiple sclerosis that there really are, because we don't know what causes it, let's say this study over here only had 2 kinds of multiple sclerosis that would be treatable by this drug. But this study over here, most of the patients had the kind of multiple sclerosis that would respond to medication. So you're going to get completely different results between these 2 studies. So you can't say because you got 35% over here and 90% over here that this was the better study. Does that make sense? You just have to have head-to-head competition. And the reason we don't have head-to-head competitions between drugs is it's really expensive to do, and nobody's going to make money off of it. You only make money by finding one drug and proving it works, and then you can make a lot of money off that drug.
The drug companies like to be very tough.
Which is, I'm saying that as a negative towards drug companies. Yeah. Okay, so I'm out of time, but I really appreciate everybody's attention, and I'll be here the rest of the day, so anybody who wants to talk to me, I'll be there.